Good morning, Ford. I want to thank you for getting together with me this morning to talk about nutrition. As you know, Ford, we're part of our wellness dentistry network, and dentists, what we're trying to do with our patients is help guide them to more inflammatory control. And I want to explore the idea of inflammatory control through nutrition with you this morning. Is that okay?
That sounds great. Thank you, Doug. Looking forward to it.
Yeah, so one of the things that we know, Ford, if we look at these different studies about nutrition, is that if we can, there's no question our diet can reduce the inflammatory components of gingival health. And so gum health, basically, gum disease. So this study showed that if you have a diet low in carbohydrate, rich in omega-3s, fatty acid, rich in vitamin C and D, then you can significantly reduce periodontal or gum disease inflammation. And that's a big deal. And so there's a couple papers on here that that suggest that. And this paper, this on the left over here, this particular paper showed that you could get a reduction in bleeding and a reduction in gum disease just by having this ideal diet. So one of the new things out is called Prolon. And Prolon is a fasting mimicking diet, and it's based off this work of Valter Longo, who wrote The Longevity Diet. And I don't know, maybe Ford, you probably know more about that piece than me. How would you introduce the Prolon concept to a patient or to a friend?
So it's a good point. Thanks. I don't know that I know more, but I do have an interest in this. I'm pleasantly surprised to see what you showed about oral inflammation. I have often wondered that, but just never got around to asking you. I do recommend the longevity diet, the Prolon diet, and there are quite a few folks that have Me Too products out there. Longo is just like most other originators and founders of a product. He's very concerned about folks that would make their own or buy an imitation. Here's some of the key components of his diet. He cuts a lot of the protein out and most of the sugar, especially the simple sugars. Sugars especially, but protein as well, has a way of impacting some of the metabolic pathways that lead down that inflammatory path.
And wasn't the idea that this strategy is an anti-aging strategy? You can actually reverse some of the biomarkers of aging. That was kind of the idea, right?
Absolutely. You know, it's an interesting point. Everybody knows Valter Longo for the fasting mimicking diet. But look at the title on that book that you've got there. That's not what he calls it.
The longevity diet.
Exactly.
So what I was thinking about is recently I realized how many people were following some kind of specific eating pattern, and what the hottest topics now are is this fasting or this intermittent fasting or time restricted feeding, that kind of thing. So what I wanted to do for it is I actually I looked at what this diet promises, and the nice thing about the longevity diet from my perspective is everything you need is in a box. And so you don't have to make it up. You don't have to shop. You just get what's in the box. That's what's kind of cool about it. And it promises to do these things on the left, decrease body weight, increase stem cells, which I thought was amazing if this could happen. Decrease A1C, blood pressure, triglycerides, LDL, total cholesterol, insulin growth factor, C-reactive protein, and glucose, and then the idea is no loss of muscle mass, because sometimes if we fast or we don't take in enough nutrition, we can lose some muscle mass. So it also promises to put the body in this protective and stress resistant mode and promote self-repair and remove damaged cells. And I thought, hey, if all that stuff could happen by being on a product for 5 days, once a month, and then you do it for 3 consecutive months, I wanted to see what would happen to my blood biochemistry if I did that, because I am very much interested in the inflammatory metrics in dentistry and in whole body health. That's what I wanted to see. We also know that there's a little self-assessment that people should take, because Prolon's not for everyone. Like, you wouldn't want to be pregnant and go on Prolon, or maybe you wouldn't want to go on have a be a diabetic and go on Prolon if you're on diabetic medications, or we would need a physician like you. So I just want to show you for it, and I know you're familiar with the product, but everything you need's in the box. You got 5 days, just eat what's in the box. You do it once per month for 3 months, and then you can do it indefinitely, once a quarter, or you can do it. I don't know, Ford, can you overdo it?
He would say so. Valter Longo is a very conservative guy, and he starts off his book saying this is about fasting. But if you look at fasting, it's not easy. There are people that have been fasting. They get in their car to go somewhere and have a wreck because of hypoglycemia. There are other issues, dangers associated with, as you mentioned, diabetes, really more the diabetes medications. I think that it's very, well, and in fact, he mentions in his book, those of us that are interested first in weight loss can use this much more often than a routine maintenance mode.
Okay.
So yes, the routine maintenance mode is to get to like once a quarter. People losing weight can use it once a month for a much longer time.
Okay.
I would say you could even use it more often than that. Again, we're talking about something fasting, which people have been doing forever, but a far gentler, easier, and biologically much better way of doing it.
Okay.
Much easier.
So Ford, I've been tracking my my blood numbers for a long time, and I have about 7 years of data. And when I look at my total cholesterol over the 7 years, my total cholesterol averages about 175. HSCRP, the inflammatory component of whole body inflammation, my average is 1.8, which is actually a little elevated. But at times in my life, it's been better, and at times it's been worse, probably like most people. And then HbA1c, the average was 5.68 over about 7 years. And so on Prolon, going on the Prolon for 3 months, and once a month for 3 months, this is what it basically did. These were my average numbers. It took my total cholesterol from average 175 to 136.
Wow.
Which is a nice shift in cholesterol. It took this average HSCRP from 1.8 to 0.3, and then my HbA1c went down to 5.5. So I do think there's a lot of promise for this product for people that want something easy, that can help them reduce some of the inflammatory biomarkers. So I wanted to share this with you, and I thought it was interesting because I'd like to see how I can build on it from here.
It's very interesting. How many episodes of Prolon have you done?
Just 3. To get these numbers, I just did the 3. I started this in January of 2018, and then I remeasured in April. So I did January, February, March, and then I remeasured my blood chemistry in April. Basically, I did the blood chemistry the week after I finished it in March.
Were you trying to lose weight as well?
No, but I did lose over 10 pounds.
Oh, really? At this point, are you looking to lose weight, or are you set?
No, I'm okay. But I think doing this for me, it just helps kind of reset the thermostat. You're being very careful what you eat. There's no drinking while you're on Prolon, so it's really a nice resetter just to give you a little reminder of it's just good all the way around. I think for me, it's been a really good experience.
Let me ask you something. Your second time, or even your first time, did you have any episodes where you felt just really tired or really hungry?
No, I lecture quite a bit, and I lectured on the 4th day, and I had really? maybe you might feel a little lightheaded or something if you're, for a moment, but no, I had really no problem. Some people will report getting a little, hangry, a little hungry and angry on the thing. They're like, I'm not feeling so good. And other people might react. There is nuts and there is some soy in the product, and there might be something that doesn't agree with some people, but most people that I've experienced have been able to tolerate it really well.
I had a little bit of episode day 4 on my first one, and had a tiny piece of salmon, and I was fine.
Yeah.
The second, third, fourth times, I really didn't have a problem. And as I mentioned to you before the taping here, I've graduated into some water fasts as well, 48, 72-hour water fasts. And I'm surprised at how well your body accommodates to the fasting experience.
Great. Well, that's all I have on Prolon, Ford. That's really the end. I'd love to come back and talk about more, unless you have any other ideas to close on the fasting mimicking diet in the product Prolon, and what else we could do.
Well, there is one thing I would say, and for those folks who think that you're just it's just another way of caloric restriction. There's some components to that. All of us are looking for the fountain of youth. The reality is we've had a fountain of youth for a long time, 30 years. We've known about caloric restriction. The problem is significant caloric restriction is painful. This is a kinder, gentler way of doing it. But as I mentioned before, it's more than that. There's a thing called epigenetics. Our genes don't change, but how we access those genes does change. And there's evidence that that the way we manipulate our diet, and that this diet specifically helps change the epigenetics around food and prediabetes. Your numbers don't surprise me at all. They've done studies now with humans and had significant positive impact on insulin resistance. As you mentioned, they have docs review patients before they go on this, because you don't want to go on this while you're taking insulin or other diabetic medications. I have done a good bit of reviews for Prolon in helping patients decide whether or not they could take it. And routinely, for the type 2 diabetics, especially if you're just on metformin, you should be able to take it. Just don't take the metformin, especially during your first episode with this, because that's 2 ways of dropping your glucose.
Great. Well, Ford, thank you. I look forward to coming back and chatting with you about some other things.
Thanks, Doug. Good to talk to you.
Talk soon.